All right, now you're all set.
Hello, everyone. I'm so excited to be here in the new building for our very first meeting, the new and improved City Hall for our first meeting here as the Advisory Committee on Racial Equity, Inclusion, and Human Rights. This is the August 26th meeting. Oh, right there. And so because we have our ordinance change, which does require that we take attendance, we are going to do a roll call vote to begin, so we can properly track attendance here. So I will begin. My name is Katie Bryden, and I am present. Shane Boyce.
Present.
Leanna Fellis.
Present.
Mark Roth.
Present.
Gabrielle Wiley has been excused. Katie Robinson will hopefully be joining us shortly. She did communicate to us that she intends to be here. Raylan Burke.
Present.
All right, and we have our City Council liaison, Mike Beck, with us here, and our student advisor, Emmy Nguyen. Thank you both for being here. We have a new member joining us today, officially started with our committee, Ray. Is it okay to call you Ray? Good, because I just did.
Perfect.
I'd love for you to take a moment to introduce yourself if you would like.
Yeah, sure. My name is Raylan Burke. I was born and raised in Maine. I am the oldest of 3 girls. I went to Old Town High School and graduated from Hudson University in 2022. And I am so grateful to be here with you guys and for our community.
Great, thank you so much for being here. We're really thrilled to have you. Welcome.
I just want to note that Catherine's on there. I just promoted her.
Oh, thank you very much. So for the record, Katie has joined our meeting and is present. Nice to have you, Katie. Thanks for being here.
Thanks. It was said chat disabled. I couldn't get in, but I think I'm in
We're
now.
glad you're here. Thank you. All right, so to kick us off, we will start with our general public comment. We are beginning all of our meetings with 15 minutes of public comment. For those of us that are joining in the room and online, we will take that public comment for 3 minutes each. This at the beginning of the meeting will only be open for 15 minutes, but because we have, I know a lot of folks that have joined online and are here in person for the interest in time and our agenda, instead of waiting until each piece of the agenda comes forward to speak on it, we are welcoming folks. If they do have something to say particular to anything on the agenda, they are welcome to speak now. And once our 15 minutes has been afforded, we will close public comment, move through with our agenda, and then evaluate whether or not we need to open it, again, based on how many folks have either joined us or have more to say on particular topics, or at the very least, open it again for another 15 minutes at the end of the meeting. So with that said, if there are folks in the room who have something they would like to share based on what's our agenda, I welcome you to come join us at the table for your 3 minutes to share. Everybody just waits.
So I'm assuming, I did not see the agenda. So I'm assuming this is regarding ICE, and
we do have LG 287, or excuse me, 287G on our agenda, as well as LD 1971, just to do a quick review of that.
So thanks for the opportunity to speak. My name is Mary Ann Larson, and I'm a property owner here in Bangor. We don't have to imagine anymore what it would look like if the president began to create his own private police force. With the additional $170 billion being committed to ICE and Homeland Security, we will see an enormous ramp up in kidnappings and deportations, often of people who have been part of our communities for decades, who are part of our labor force and whose children attend our schools. Should the Bangor police begin working collaboratively with ICE, trust between citizens of Bangor and the police department will be eroded. It may take years to restore that trust, and diverting police from legitimate policing activity won't keep citizens safe. While Trump said he would only deport criminals, they're actually racially profiling, attempting to rid the country of people of color. Traffic stops refer to an important press article Sunday all involve brown-skinned individuals. In many cases, those being arrested have pending asylum claims with permission to work. According to the Maine Immigrant Legal Aid Project, many of those being impacted by these abductions were quote known to be in a lawful immigration process, have a valid work permit and no criminal record. Border Patrol is showing up at work sites throughout the state. There were 439 at-large arrests along the northern border in July, compared to 166 for the same time last year. They're using drones to observe work sites, signaling broad concerns about privacy and Fourth Amendment rights. There is little public support for these immigration policies. Supporting this lawless overreach will not make Bangor safer. As a property owner that calls Bangor home, I pray it won't come to pass. Thank you again for the opportunity to speak. I made a couple of copies of this, and I apologize. I don't have Word on my computer anymore, so I did this. I wrote it out by hand. Fortunately, I have fairly legible handwriting. And I also made a note of reference to a Maine calling program on deportations, a recent program in the Portland Press article that was just in Sunday. So I will leave these. Just have 3 copies here. I'll read these to you folks.
Thank you so much, Marianne. I really appreciate your copies and being here this evening and sharing your testimony. Thank you. Hello, welcome.
I'm Kate Cook. I am also a property owner in Bangor. I agree with everything she said. Things that I want to address are rather a sense of urgency. I believe that we started coming to the council for this in May and bugging them in the council meetings, and then we followed up with you folks a little bit later. The state isn't going to be moving forward on this in any swift manner, and the time to move forward is past. I would really wish that we should just add a sense of urgency to us moving forward on this, especially since the bill, I believe, with the state senate is sitting on Janet Mill's desk for signature, and it's, yeah, we can't say that anything's gonna happen.
Yeah, thank you so much, Phoebe. I really appreciate your sense of urgency and sharing. Thank you. All right, seeing no one else in the room on public comment, I'd like to open it up to our Zoom participants. If they would like to speak now, can we unmute?
Either of them have their hand raised.
Oh, Joshua or Zach, if you are interested in giving public comment on any of the items that are on our agenda this evening, you are welcome to either raise your hand now so we can unmute you. Thank you.
Hi, can you hear me?
Yes, we can. Thank you.
Great. Thank you for the opportunity to speak with the committee today. I know your efforts to champion diversity, equity, inclusion, and human rights in the current political climate comes with personal risk and sacrifice, and I appreciate each of you for continuing this vital work even so. My name is Joshua Faye. I live and work in Bangor, and I'm here to express my strong support for a city ordinance which would prohibit Bangor police from entering into 287G agreements with the Department of Homeland Security's United States Immigration and Customs Enforcement Agency. Let me begin with the main reason I support this ordinance, my unwavering belief that immigrants are welcome, integral members of our community. Immigrants are not illegal people. They are fellow human beings. They are our neighbors, coworkers, classmates, and friends. They are essential to the fabric of Bangor's culture and economy. Our community is stronger, safer, and more vibrant because of them. And like all the members of our community, whatever their resident status, immigrants are entitled to equal protection under the law and due process. These are not privileges for a select few. They are constitutional guarantees afforded to all people residing in the United States. Yet time and again, federal immigration enforcement, especially under the Trump administrations, has trampled those rights in pursuit of a mass deportation agenda. And I use deportation in air quotes because that's not exactly what they're trying to do. And in doing so, they are attempting to trample over the rights in pursuit of that agenda. Customs and Border Patrol and Immigration and Customs Enforcement, among other federal agencies, have detained individuals without proper due process, separated families, and are operating with little accountability. often with the cooperation of local law enforcement, including right here in Maine, unfortunately. Federal agencies, including ICE and CPB, have reportedly abducted hundreds of immigrants across Maine, including here in Bangor. Many of the people taken in other states, have lived in other states and were here to work on various job sites. Most possessed valid work permits, had no criminal records, and were following lawful pathways to permanent resident status. These abductions of law-abiding immigrants have become so disruptive and concerning that immigration lawyers are advising their clients to avoid traveling to Maine altogether. I believe such actions are intended to not only help the Department of Homeland Security meet increasingly nonsensical mass deportation quotas, but to terrorize our immigrant communities and negatively impact Maine's economy by discouraging immigrants, citizens or non-citizens, from migrating or traveling to the state. And I think it's become very clear that the Trump administration is targeting Democrat-led states because of their opposition to the administration's unconstitutional and illegal policies and actions. Once more, the President of the United States has been openly discussing suspending habeas corpus and trafficking lawful immigrants and U.S. citizens to foreign countries to be imprisoned indefinitely. He is opening what are, by definition, concentration camps in remote areas of Republican-led states and to hold the abductees. The president has been deploying National Guard and active duty military personnel to American cities and threatening to send more to other cities in violation of Posse Comitatus. Just today, in a nearly 3-hour-long cabinet meeting in the White House, in response to a question about sending federal troops into Chicago, Trump said, and I quote, "I have the right to do anything I want to do. I am the president of the United States." This, to me, is a clear indication of an intensifying constitutional crisis, and is precisely why Bangor must draw a firm line. We cannot allow our law enforcement officers to be deputized into federal actions that violate civil rights and flout the Constitution. We cannot put those tasked with protecting and serving our communities in a position of harming them. We cannot expose the city to criminal and civil liability for illegal acts, which has occurred in many other municipalities, based on their cooperation with federal immigration enforcement. And we cannot bear the immense financial and human costs of carrying out these enforcement actions on the federal government's behalf. An ordinance that prohibits Bangor police from entering into 287G agreement with ICE is not about politics. It's about protecting the rule of law. It's about defending civil liberties. It's about keeping every member of our community, regardless of status, safe from illegal and unconstitutional abuse of power. And it is about avoiding placing yet another financial burden on an already cash-strapped city. As a property owner, I understand each year our property taxes, relatively speaking, has gone up, even though the mill rate has gone down, and that would only increase with this further financial burden. That's one of the things that the ICE doesn't really want people to think about. I urge the committee to recommend such an ordinance and send a clear message. In Bangor, we do not collaborate with agencies that violate civil rights. We do not aid in deporting our neighbors without due process, and we do not compromise our values or abandon the Constitution for political expedience. I believe the old political maxim can be true again. As Maine goes, so does the nation. I sincerely hope we act now to show the rest of Maine and the nation which way it should go. Thank you.
Thank you for your comments, Joshua. And Zach.
Hey, everybody. Sorry, I don't have as much prepared to say, but I want to echo everything Josh said. I do think entering into 287G programs do harm communities. I think immigrants make communities strong. Over 100 people in Maine just this year since January have been detained by ICE, including a police officer who, as far as I know, didn't do anything wrong. And I just don't think that's what makes communities strong. So I would oppose entering into a 287G program, and also would reiterate that immigrants make our communities strong. Thank you.
Thank you very much for your comments. All right, seeing no other individuals for public comment, we will go ahead and close our public comment portion for now, and obviously keep those comments in mind when we get to our policy and ordinance section of our agenda later on tonight. So, thank you again, everyone that has come to share. We are very grateful for community involvement and participation on these matters. Moving forward, I would like to move for approval of the minutes for May 6th and May 27th. We had 2 meetings in May, both of which need approval because we did not have quorum for those 2 meetings. Our June meeting minutes will be available for us to review before our September meeting. So that being said, can I please have a motion to approve the minutes for May 6th and May 27th of 2025? Thank you.
Second.
Great. Because we have a individual online, is it that we do a roll vote? Thank you for the reminder, Courtney. Okay, for the roll vote for the minutes, I'd like to begin in the room with Mark. We have to approve vocally, loudly, because we have Katie online.
I approve.
Approve, all right. Shane,
Yes.
Ray,
Yes.
Leanna.
Yes.
I approve, and Katie.
Yes.
Okay, thank you. That is 6 yay, 0 no. All right, moving on to committee business. We start with our education updates, and we have an update from public health. So I would like to please invite Jen Gunderman to the table for an update. For those of you with the packet, she provided a memo on the current updates that we look forward to hearing more from you. Jen, thanks for being here.
Thanks for having me. What a lovely evening today. So,
Beautiful.
I appreciate you here this evening. I know that I provided some updates to City Council about the HIV outbreak, and I really appreciate the opportunity to update this committee because I have been doing HIV work decades across the globe. And the one thing that's quite common is that this is an issue. It's about stigma, this is about barrier to services, this is about discrimination, and this is about populations that are marginalized. So I really appreciate you calling attention to this outbreak. And I provided sort of a list of updates of where we're at. I will just briefly highlight them, but really I look forward to your questions or comments or thoughts. As of today, we do sit at 28 cases that have been reported to the main CDC. One of the things that's really important when we say cases is that these are people who have tested positive in a setting that requires a report to the main CDC, their state health department. So people say, for example, could have done a self-test at home and tested positive, but that's not getting reported. People could have HIV and not have been tested at all. So we are anticipating that this number of people who are impacted by the outbreak is much larger than 20. When we look at certain modeling that's been done in other research, we could even say this is maybe double that number potentially. There's been a lot of challenges along the way. I've been here for a year and a few months, and when I came in, I think the outbreak was around 9 cases. And already we were seeing some challenges that sort of just kind of grew over that time period. One of them being, the ending of our Health Equity Alliance. They were the largest syringe service provider. They were the HIV Medical Case Management Agency, and they just provided a lot of services that this population really looked to. So when that organization sort of slowly started to have services change, it definitely impacted which required a number of other organizations to kind of step up. So one of those organizations has been Wabanaki Public Health and Wellness. They were a syringe service provider at SSP, primarily focused on the Indigenous community. Then they expanded their services to be open to all people. And then Needle Point Sanctuary was also certified up in the encampment during the time that the encampment was there and provided a lot of services in that area. As we know, the encampment has closed for a number of different reasons. There's been some challenges with accessing people because they have scattered or they're constantly moving to be out of the purview of where law enforcement might be. So we have been working really hard with community partners to identify where people are at. One of the things that's really grown out of this outbreak in a silver lining type of way is that the collaboration among partners, I think, are stronger and stronger every day. Whether it's us, Goffstown Community Health Center has been providing street medicine. They never treated a patient for HIV before. Now they're the HIV treatment provider for this outbreak. And that was done because Amy West, who does street medicine, partnered with Northern Light UMC Infectious Disease Program, who did a lot of HIV treatment, but
not in a street medicine model. So they really collaborated and learned from each other. Also at PCHC, their home team has really helped with some like light case management, like helping with housing, helping with connecting people to appointments, community health and counseling services. Their options and PAC team have been instrumental in identifying where people are at, getting them services, providing housing support. Needle Point Sanctuary again was certified and continuing on their certification journey for a brick and mortar and other locations. They've provided Taco Tuesday, which has become very popular, that provides wraparound services. Wabanaki Public Health and Wellness, also an SSP, also providing services. We're looking to develop a longer term one-stop model with them, sort of like Taco Tuesday expanded, but has an access and a little bit more, a little more often. Some of our public health nurses have already started to work in that space, looking to add telehealth, some basic services. Family planning. Family planning has worked closely with Needle Point Sanctuary on that Taco Tuesday to bring their mobile unit in. We are concerned about what just happened yesterday for family planning, if anyone is aware of that. So when the reconciliation bill passed, how long ago was that now? There was a provision in that bill that said any organization that provides abortion services cannot bill Medicaid for any service. Maine Family Planning sort of tried to file, I think it's, I don't know lawyer term, I think it was like an injunction, or one of those things with the courts. And just yesterday, the courts ruled that this is in the bill. It's not like an executive order that they can stop. And so we haven't had a chance to connect with family planning or Maine Care to understand what that means, but that could put a real barrier to this continued work. They were, Needle Point Sanctuary, they were significant providers of PrEP or pre-exposure prophylaxis, which is really important. So we're going to be watching to see what happens there and what that means and how we can work together as collaborative partners. These things, organizations along the way, but I want to make sure I also shout out to our hospitals. Northern Light EMC, their infectious disease office, as I mentioned, has been worked really close with PCHC to train on HIV treatment. St. Joseph's Hospital, their care coordinator, Jess Taylor, has been really instrumental in helping us to identify people that may test positive in the hospital and how they can get to services. And actually, Dr. Busco at St. Joe's is sort of the first one to pilot offering self-test out of the emergency department, as well as some of our incentive coupon cards for getting tested. Just screening for HIV in the emergency department if you don't have symptoms. So one way that we're sort of working around that under Dr. Busco's idea was to self-test for people. Northern Light took on that model as well. So when we're talking collaboratively, like it is all hands on deck. A lot of sort of silos have been broken down because of this. More to go. We're learning, because what we're doing right now is responding still to the outbreak, but also trying to build long-term solutions, because we now know we have people in our community who are going to need that long-term support. The last thing that I'll just sort of mention real quick is the case management. So the Opioid Settlement Fund Committee passed a proposal for intensive case management. City Council also passed that. That money was being provided to us at Bangor Public Health and Community Services because, based upon our conversations with community partners, we were the ones who could probably act on it quickly, while the other organizations figure out how they're going to do potentially HIV medical case management. And the backdrop that I want to provide you with is HEAL provided HIV medical case management for about 140 and 150 people who've been living with HIV for decades in all of northern Maine. They never really took on any of the cases from the outbreak. It might have just been a few, because their case management model wasn't built on meeting people outside of an office, because they had a huge caseload. So what these funds for intensive case management are allowing us to be able to do now as a collaboration is to support people in their journey to health. And that's a comprehensive approach. It's about not just HIV and hepatitis C, see. It's about linking them to care when they're ready for substance use disorder, for mental health, for primary care, for housing, for basic needs. I'm happy to report that we were given funding to hire 2 case managers. That job description has already been put on our website. We are starting interviews tomorrow. We've also been in partnership with Frank Peabody, who does the HIV case management in Southern Maine. They are working with us on how to build our policies, how to build our paperwork, how to build our monitoring. And we also have a couple of phone calls set up on identifying our clinical oversight, because that's important. What we're trying to do is build an HIV case management model so that when opiates on the funds go away, we have an infrastructure set up to build Maine Care. This intensive case management is like HIV medical case management expanded. So what we're doing now couldn't even really be billed under HIV medical case management because it's more robust. The funding also included transportation. We're going to be able to lease a car for 2 years. This is huge. We can get people to dosing. We can get people cut. We can get people to go do laundry. You know, really that holistic approach. So we're really excited to be able to get going in that way. Again, total collaborative approach on that. Stop there. And
That is so comprehensive, Jen. Thank you so much. Thank you for all of this detail really outlined so comprehensively for the memo, but also just for that really more informative update. Thank you so much. I would like to open it up to the group if there are questions.
I have a question.
Yes, Mark.
With regard to family planning, this is actually a twofold question. So one is, are they operational now? And number 2 is, what is the plan to try to obtain funding since prohibition is in the bill?
that's a great question for family planning. I don't know. I can find out. This was news that just happened yesterday. We saw some family planning on the news today. As far as I know, their doors are still open today. I think they're going to really start thinking about what that looks like. They also take commercial insurance. Right. They have a foundation, and some donation fees. So I don't know how their operations may change. I think we'll learn more about that over the next coming days or weeks.
And just as a follow-up, to be clear, this is just for Medicare, right? Folks that are Medicaid, excuse me. Yes.
Maine Care. Yeah.
Yes. Thank you very much. Obviously a huge population. Thank you for that clarification. Are there other questions for Jen while we have her?
But they're like scientific, based type questions, like, you bring a wealth of experience to this role. I mean, you're coming to the community of about 40,000 people here. And, you can see online people are very, shocked by this and how it's growing. What does this, in your other experience, what does this look like? Like, how does this continue to play out? And you said, 28 cases is what we know. We expect it to be bigger. What are we able to offer wraparound services is so crucial on every level, because we know that this impacts certainly the individual, but there's family, there's other pieces. What does it look at like 6 months, year now? What does it look like? I know, like a scientific based type question.
I think we're coming to the point in the outbreak, and this is just my opinion, in working with our community partners. I think we've come to a point in the outbreak where I feel like we're less frenzied. And I think that will allow us, because what happened is, from my observation, is a whole bunch of organizations saw all the needs and threw everything at it. What sticks, right? Mm-hmm. We were bumping into each other. We were duplicating some things. We were inefficient. I think we're at a point now where we know cases can continue to grow. I think each organization is starting to learn, like, okay, this is my lane that we're really good at. Mm-hmm. This is how we can overlap and connect here, but all of us don't need to be doing everything. Right. I had to learn that for our own department, is to say, where do we actually start to say, we're willing to help and support and collaborate, but this is what we're really good at, and we have the resources for it. So I think what I see in 6 months is us settling into a better system. I think we were also anticipating a different type of outbreak response from Maine CDC, and that isn't what sort of happened. And so I think for a while we were sort of waiting like for Maine CDC to kind of do certain things. But what we learned is that we really need to work together as a system. So I'm hoping that we're like, taking another breath, saying, okay, smart. The one other thing that I want to add that your group would be interested in is we have a Masters in Public Health student coming on this week who is going to do a project around stigma. And what they're going to do is some interviews, focus groups, really asking the community and community partners like how stigma has impacted people in the population impacted by an outbreak. What is the messaging that we want really around this? Oftentimes people say we should have an education campaign about HIV, which is true, but we also need to have we care about you campaign. So we're kind of trying to figure out what is the right messaging and communication around stigma. That's really exciting. So I'll be happy to present results when that's completed.
That would be wonderful. Does anybody else have any questions? I'm curious, Jen, obviously the collaborative approach is it's working, right? And I'd love to see that. I don't know if this is a fair question, but is there, because I obviously recognize the value in equity, but is there an area that needs more help right now? Do we need more needle exchange programs? Do we need more focus on these wraparound services in terms of all of our connections and networks and where we can reach out and support and garner interest? I'll be honest, it seems to me from a very uneducated outside perspective that needle exchange is where we need to be focusing our efforts. Do you find that to be, is that a fair question to even ask?
I think it's definitely one of the areas. I think that needle exchange SSPs are vital to addressing this. When you look at what happened to Indiana, Scott County, Indiana, they had over 100 cases in a smaller population because they had no SSPs when this first started. So this is an important part of our toolkit. I would say there are probably other needs just as equally important. And I would say addressing mis and disinformation goes hand in hand with that because it's part of the harm reduction model. I think that we have to be potentially prepared for shifts in federal policy funding considerations. And I would also say that just as equally important is the PrEP. We think of prevention, that PrEP piece is also super important. And stable housing, transportation.
No, thank you for that. Oh gosh, I just had it. Just sort of in that, with this individual that you have to come doing these interviews, with that information, I mean, obviously, like you said, the misinformation is working against us in terms of people's assumptions. What will they do with this information? Is it a matter of just here's a PowerPoint on how to not stigmatize, or what are we doing to?
So what she's going to do is she's going to do a literature search around what are evidence-based or evidence-informed practices for addressing stigma, particularly when it relates to HIV, substance use disorder, homelessness. She's going to do interviews to understand what it means for people, what is the experience, and then there will be a PowerPoint that will summarize that. And then there's a couple of actually examples of materials that could be used. Is there posters that we could put up? Is there social medias that, posts? I'm middle-aged. I don't know what they're called. Memes, gifs, whatever they are.
Join the club.
You can figure out the TikToks to do.
The TikToks, yes.
So she'll build using materials that use in other places, build actually some materials up. It's great. It's wonderful.
I just have one quick question. the two people, the interviewing that's gonna be starting tomorrow for those case managers.
Yeah.
Do you have a sense as to how many, people that each of them will be serving?
That's an important question. So right now, the way that we have been directed to use the funding is for people who are part of this outbreak. And what we know is that there's 28 cases right now. We imagine that that will grow. Because this is intensive case management, the research indicates that it should be on average 15 to 17 individuals per case manager. So that's the model that we're going with right now. We have been building relationships with people impacted by this outbreak and letting them know that this is going to potentially be coming available. So we're getting them sort of, we didn't want to overpromise and underdeliver. So we're just like, hey, this might work out. So we'll be able to kind of build on that. And again, work with our community partners to do some of that warming and up.
Thank you.
You're already out in the community, these individuals, you're already working with them. Are there individuals who don't want the assistance, who don't want the case management?
There probably will be. I mean, it's not uncommon for someone to get this diagnosis and not move quick or a lot. So there's a possibility and we'll continue to keep trying to engage. Just say hi. Bring some food, you know, you just continue to build that relationship slowly. This is a combination of just a lot of times.
Well, and that's why I asked the question, you know, this is something we've heard over the last several years, you know, with all the different organizations that have worked with these population substance use, you know, that's always something that comes up. It is a person's choice whether or not they want to. Just to know if you've already engaged in those conversations, if you have heard from anyone who's like, no, you know, but to your point, there are those who just acknowledge it, and for those who are just like,
yeah, I mean, there are people who have sort of disappeared in some ways, you know, because they're struggling in many different avenues. And you know, one of the questions that we're going to have to the liaison is like, how do we define success of this program? Like, how do we evaluate? That's kind of like where I'm scratching my head a little bit and looking to other models, because the success is going to be based upon, is somebody meeting their own goals, right? We're not going to tell them what their goals are. And this is a collaborative approach to determine, okay, what is most important to you right now? And how can we help get you there? So to say our goal is to get everybody housed in their own right, like that will probably be unrealistic. Can we move people along a trajectory to housing? Absolutely, but we're going to work with what people think their goals are and help to empower and foster that.
Thank you. Any other questions for Jen while we have her?
My question
Shady,
is.
sorry.
My question is, how is the city going to work on that? Are they going to not move folks from where they are currently stationed, where they are easily accessible? Is the city working with you to maintain these connections, these relationships you're building, or is that going to be a source of friction as you move forward, where your department is working against the greater model?
Great question. I think that we continuously explore how different arms of the city can have a similar mission.
That's not really a question that can be answered.
Thank you, Dee. And
I just have a
Sure, go ahead.
comment. It's not really a question. I'm concerned, and I know a lot of people in the community are concerned with what happened with Needle Point, that they had a space, they had provided service, and then oops, the area is not zoned appropriately, so they can't operate. I think that's a huge issue, and I don't know, like, from the city's perspective, what's happening with that? Are we working on rezoning? Have we been partnering with Needle Point to help them find a space that is in an area that's zoned for this service? I think the reality is it is one of the areas that needs to be addressed, and this is something the city can easily do. We could say, we will rezone that spot that you are in, or we will help you find a spot that is appropriately zoned. So I don't know if anybody wants to comment on that, but
I can start that. I mean, we've been in conversations with Lily. So I just wanna add a piece to this situation that I think is important to know is that, first of all, the zones have been in existence for a very long time and what the permitted uses are. One of the sort of lessons learned from this is when an agency puts in an application to Maine CDC to have a certified site, we do not get informed. So what happened was we were informed that they were certified for that site after they had gone through a long review process. And then we get the letter and we say, it's not a permanent zone use. So what I'm hoping, and we've had conversations with CDC, is that bringing municipalities in from the beginning to say, hey, let's have this conversation now. So we have had, myself and other departments have had conversations with Lily since then. There is a very specific process about going for, I'm gonna speak language I don't know, variance, exemption, is one of those terms, and have told him that that's the process. And he is more than, like we have said, this is how you'd be categorized. If you wanna go ahead and get a zoning map to figure out where those brick and mortar zones are. And what I'm hoping for is actually a larger conversation on what is our strategy for from distributing to cleanup, and how are we all going to work together on this? What do we want for brick and mortar? What makes sense? And so, you know, I talked to Lily about it as well too. So we're helping to foster him through the process, and it takes a little bit of time. I don't know where he is at this moment in the process.
Yeah, unfortunately, I don't know either, but I will say back to, Courtney O'Donnell, Assistant City Manager. Back to what Director Gunderman was saying is that had we been notified early on while they were going through that process at the state level, we could have facilitated things along faster on our side, because regardless of whatever business or operations you're setting up, you have to go through the proper permitting process for the city. And so I think if we're able to kind of get in on that earlier and know what's going on, then we can, you know, both paths can be kind of happening in conjunction with each other instead of end to end, which would help reduce some of those concerns.
Thank you, Shane, for that question. Any last comments or questions for Director Gunderman? Yeah, so we're very
I'm happy to come back. This is a great group.
Yeah, no, I would love to have you back. I think you have continued good information to share, and I would also love an invitation to the partners that you've been working with as well, to have them on our agenda to hear for what that collaborative space looks like and how we can continue to support. Yeah, thank you very much. All right, moving on. And next in our education updates, we have a community development block grant update. We see our DDG grant update. Welcome.
I might have been in the wrong committee meeting. I was like, some changes. I was like, we have planning board?
Yes, thank you.
We're all here.
All right.
It's actually really nice to hear that, because I don't often hear Jen speak. And I guess my only regret is that we didn't realize that we both worked at the CDC at the same time. We're here, and she's great. I love everything that she does.
Robin, can you introduce yourself?
Oh, yes. Hi, my name is Robin Stanek. I'm the Community Development Officer.
Thank you very much for being here this evening. Robin, we're looking forward to hearing, an update on this CDBG.
Yes, so I just wanted to give you a quick community development update. This update is dated in July, so I actually have more updates that are on the page, even updated on the update. And the first one is talking about our annual action plan. So as a requirement of all of our HUD funding, we need to annually tell HUD how we're planning.
I'm so sorry, Robin, can you just give a 2 or 3 sentence explanation of what CDBG is?
Yes, I do. Okay, so this backing up. So the city of Bangor receives a non-competitive grant from the US Department of Housing and Urban Development, and it's called the Community Development Block Grant. And this essentially is a pot of money that the city can decide how best to use it, rather than other types of competitive grants that say, we will give you this money and we want you to use it specifically in this way. So every single year, we have to develop a plan to tell HUD how are we gonna spend this money. Now, this year was a little different. We weren't really sure what the status of the HUD as an agency was going to be, how we were going to need to kind of move through what we saw as pretty, uniform and kind of basic things that we do every year. So we did submit our action plan according to the memo. However, and this is just today that I found out that our action plan was rejected because I mentioned this committee, and this committee has a name, and in this committee's name is a word. So we have to resubmit it, so it's gonna take us a minute to actually have an approved action plan. But it is going to be lickety, yes, it's through them, and they wanted specifically their action plan written in a certain way. So it was something that I did not catch.
May I clarify? Excuse me, I'm sorry to interrupt you. I just want to be clear. So you submit to HUD the plan for what to do with this grant money.
Right.
Non-competitive, you said, right?
It's non-competitive,
Yes.
so essentially they're going to give us the money as long as we
Follow the expectations, and one of those expectations is to, I'm assuming, not meet. Can you say more about it? Is it the meeting with us? Is it the collaboration? Is it our?
Well, the action plan has a lot of different things. So really, a large piece of it is talking about who you talk to find out how the community wants to spend the funds, what need you're spending, you're seeing in the community that you can address with those funds.
Okay.
And in this particular year, we were advised to go through our entire plan and scrub certain words. And I did not look at the name of this committee when I looked at every word. And so it was an error in my part. I never even, as I went through it. And so we were just told at like 4:43, oh, you gotta redo it. So it does mean that some of the actions that we've put in place to put some of those projects, I'm gonna have to pause them until next week when I go back to these process. So I just, because I saw that this was our update about our annual action plan, and I say that it's been accepted, it was not approved. And that was a today thing. So I just wanted to be forward about that.
Is that as simple as removing the name of this committee from it, or is it extensive?
I'm just going to remove the name committee, and I'm gonna say various. In other areas, I mean, my HUD rep said, just replace the words with the definition of the word. But in the case of this name committee, you cannot take that word out and replace it with the definition of equity. It would work. So I'm just gonna say various committees. So I thought that was just something so that we can't move forward the same way that I had planned to talk about. You've got a little hitch in the kitty up there.
Thank you. And also just to clarify, does that mean all of the grant funding is paused until that's reworded?
Yes.
Okay.
It does.
Okay.
That being said, well, and they also give us until Thursday to fix it, but it's only one word, so I'm pretty sure I could get through it. Thankfully, my HUD rep called me and said,
you might see this like really quickly, so I got a little extra, but we didn't know what the flag was, and it happened to be walking into this committee today.
Okay.
It's the name of the committee that, I didn't even realize it. Yeah, so, but I do not anticipate that it will put us far behind. But I'm about to talk about some of the activities that we're going to do, and I'll kind of tell you like what the impact of having a delay of like 2 to 3 weeks is really going to be. So I
Thank
wanted to be
you.
upfront about
I
that.
appreciate that.
Sounds like, hey, we're, accepted, like, you
Yeah,
think like
let's go.
you're in
Yeah.
college, like I've been accepted. Well, there's another part to that. So yes, so I'm working on this. Our annual action plan is also on our website. If anyone, was curious and you want to read the document, it's also up on the community development webpage, and then there's a specific tab for the community development block grant program. So as part of all of those planning process, like I mentioned, we do go out into the community in a variety of ways. And we say to all residents, tell us about, what the needs are, what are the needs and what do you think are priorities? And we try to do it in a number of different ways. So one of the things that we did was we went and we did a pretty detailed data analysis of what could we find in the numbers with the Census Bureau, what could we find in numbers with various data points related to the labor economy and all of these things to say, what can we find out that's lay out on paper, and then how do we go out to the community and find out more. So one of the things that we did was we hosted some neighborhood meetings beginning in November of last year, because we wanted to just kind of get a little bit of a temperature read. What do people think are some of the hot issues? And what we learned was that some of the hot issues are housing, healthcare, childcare. I mean, pretty predictable, right? But we just wanted to make sure we're going out into the community, we're getting a little temperature test, and then we come back in and we do a lot of this data research. And this data research goes out in the form of a community-wide survey. So this is going to be, it's going to be a postcard. It's going to be pretty fancy. The postcard folds in half, and you can open it and you can tear off half and put that in the mail. So that will allow someone who would like a paper copy of the survey to be able to get one. They will also, there will be some other additional things that they could check on that postcard and send that in. That will also have a QR code for someone that just wants to do the survey quickly on their phone, something like that. And then we'll also have where the survey is located on our website if someone wants to sit down at the computer very intentionally fill out the survey. The survey is also going to be under 20 questions long, because that's the typical success rate for responses. Shane, did you have a question
On the
about
fancy
survey?
postcard, is the postage paid on the return?
Oh, yes.
That's perfect.
Yes, it will.
While we're I pardon my interrupting you, I'm just curious, those questions that are compiled, is that something that comes from you? Is that something that is determined from HUD? Is that?
No, we create
The survey based on specific to Bangor and what those.
It'll be specific to Bangor, and what we do is we use those neighborhood meetings, use all the data that we find out, from doing the research, and we mix it all up in a soup and we say, what do we need to know in a different flavor, or what's the nuance of this particular issue? Like, for example, we were talking about our labor demographics. And the one thing that you can't get in the data is how many people who live here work remotely. And do they work remotely from a local employer and it's sort of maybe a convenience factor, or do they work for a company that's out of state? What's that look like? The Bureau of Labor Standards doesn't actually have a way of collecting that data at the moment, because this was a new sort of post-COVID trend that's sort of blown up, right? So we'd like to learn a little bit more. So we're like, how would we massage a question like that, right? So this is how we do that. And also, I saw you guys at the
Was it Pride that you were doing under the tent with all the?
Yes.
I have part of that table, I think, I can't remember where I got it from, was it in your minutes that you just approved? Or maybe not, another minutes. But it didn't seem like it had all of the responses, so I was hoping there could be some sharing.
Oh, yeah,
Have, like, the
absolutely.
full file, I would
Yeah.
love to see
Yeah.
that, because when I saw you out there with your sticker charts, it was very, very similar to the activities that we did.
Well, that's what I
when
was
we were at the
wondering.
polls
Yeah.
and at the neighborhood meetings, a lot of like sticker dot
Yeah.
exercises.
Yeah.
And
I'd love to see that, because those are the kinds of questions that we don't wanna recreate what you've already done, and you've got a pretty good sample size, and it's really kind of neat to see, you know, that there were cells for like creating your own answer and, you know, things like that, so that was really exciting to see.
Yeah.
yeah, so we're gonna do that community-wide survey, and I don't think that it's unreasonable to expect about 1,500 responses for something that's both electronic, really short, and delivered to, you know, every address. So we'll kind of keep you updated on that. And then the second piece of this survey activity is that our high school, there's a group of students at our high school that have agreed to work with the city, and they have drafted a survey that is going to be administered to both middle schools. So it is a 4-foot-high survey, essentially, is what I'm thinking of it like. You know, these are not questions that you really would ask an adult. And it's also things that maybe an adult wouldn't pause to think like a younger person about. So they designed the survey all on their own. They decided what we needed to know about what they could tell us. And so they will administer it. So that was last year. This year they're going to administer the
Oh, yeah, I was messaging with Catherine. If you're able to unmute her, she can share this question. Yes.
Hi, it wasn't so much a question, I was listening and I heard you say electronic surveys. And so I was just putting an FYI in that I recently learned, I do research as part of my job, and one of my colleagues did a survey, posted it on LinkedIn, and the chat boxes on LinkedIn responded to the survey, and she got 147 responses in one day that were chat bots. So I just wanted to throw that out there for the committee that we're now seeing chatbots on other electronic sites, kind of messing with our research data in that type of way. So I just wanted to put that out there.
So I wonder if we'd have to put in a question there of what a chatbot would not answer, that we would be like,
Click the stop lights.
Something to show that it's a chatbot response.
So you
I
said,
don't know.
sorry, you had extended this to high school and you want to extend it to middle school. Are you also sending it to placements for students who might not be in the traditional setting and might be in a specialized placement to see what their needs are?
That's a really good note, I think. Are you talking about like if they're homeschooled?
Homeschool, or if they might, they might be in a specialized setting for disabilities or something like that?
Oh, yes.
Regional.
Yes.
Or Stillwater, things like that.
And so then at the end of that survey, the high school students will be cleaning up that data, analyzing it, and choosing a facet of what they learned and writing one page paper. So
Great.
we'll hear more about that.
I'm very happy to hear that I retired from the high school, 32 years. That kind of process could never happen. And never did it. It's certainly nice that it's evolved over the years.
Yeah. I'm very grateful that the school was willing to partner with us and, definitely gave us a lot of support and, we worked really hard with the students on this, so, yeah, I think that it's gonna be well. So.
let's see, so as moving into our new year with our annual action plan, one of the things that we've done over the last 2 years is we've started to actually run our program in a new way. And the biggest thing that we've done is we have a new platform. And this is a digital platform that we're using to accept all of our applications, to monitor and manage all of our grants and our grantees, and all of the good work that they're doing, and then all of the reporting that they give back to us. And the biggest benefit to the city for doing this is that we can get to data much more quickly than going and sifting through paper records, paper applications, and we can actually more uniformly assess, different proposals that might be offering the same thing. So we're really excited about it. It's also a really good way for someone that's looking for home buyer assistance, for example, or looking for homeowner rehabilitation. They can go on at any time of day. They don't need to come into the office. They can go and put things together. And we also do have partners who will go over an application with someone that needs help to do that. And so we launched it July 1st. So far, it's been doing really well. An example would be that we just put out a social post for our homebuyer partnership program. I think it was last Thursday, and we received 140 applications just from that. But we would not have been able to get 140 applications in paper. Like, that would have been so tedious to try to do. So it actually will help us with volume of applications, as well as, to be able to allow for some complexity there. And so we're really excited to be able to do that. So we wanted to make sure that all of you were aware of that program. And also, if you wanted to go and check out the site, see what it looks like. We did work with some consultants to make sure that, we did have a lot of many levels of sort of review in place to figure out, is it accessible in reading? Is it accessible to people that didn't have, if you're only using your phone, can you really view it well on your phone? And we also have tablets here in City Hall. If someone doesn't have internet access, we'll actually go through it with them, or we can also go and we do like a property inspection. We'll go with the tablet and we can do it from there. So what we generally do is we submit our action plan. When that's approved, we start thinking about how are we going to deliver on our promise to the residents to deliver these types of services. And most often we deliver these services through subrecipients. So we're not actually the ones that are providing the meals or, healthcare, these types of things. So we have to think about, well, who is, more optimally positioned to do this. So our subrecipient program has typically in the past been somewhat of an informal rolling basis type of application to find out who has a good proposal. So beginning last year, what we decided to do, what we decided to do was we were going to use the action plan to start that process, and that we would look at the entire year of services all at once so that we could decide which agency was better positioned to do something. And this year, it seems as though that's especially important because we see a lot of agencies that are really struggling to provide the services to the level that we can give them. So in evaluating this, we're looking at healthcare, housing, education services, and the like. And what we did was we put this out in a request for proposals, essentially. So we need these types of services. We'd like our subrecipients that are able to receive federal funds. How would you deliver these specific services? And so what we did was we collected all of these proposals,
And we have scored them related to some, certain technical reviews. So things like, do they have legal standing? Are they barred from receiving federal funds? Different things like that. Things that aren't necessarily a merit-based evaluation. Once we completed that, what we do next is we actually ask a small panel of citizens to go in and rate it on their merits. So how well do they demonstrate that they can actually deliver the services that we've done? And so this actually is something new that we're doing this year. And so we are asking members of this committee, if you are interested in being a reviewer, I would really like to hear from you through Courtney. Just let us know, instead of just, assuming that everyone here in the committee would like to do that. We'd really like to hear, folks to raise your hand if you'd like to do that. And essentially what that would be is you would go onto our Neighborly platform. You would look at the agency's proposal for that program, the way that they propose delivering it, and you would answer certain questions based on what you believe, is in the highest and best interest of that particular program or that particular need. And we do have, a rubric and a lot of instructions to help out with that. But we have, I think, one proposal per different type of service we're looking for, and a few that have a couple. So it would be in our interest to kind of hear from more than just a staff perspective of like, is this going to adequately meet the need of the community? And does it seem as though this applicant has hit all of these particular pieces? So if you are interested, letting Courtney know, and we'll, disseminate that information to you. Wonderful. And then the last thing that I just wanted to talk about, I think that kind of piggybacks a little bit from a conversation, you began with Jen, is, we've really worked hard to try to reduce some of the siloing even within the city. One of the things that I do lament often is that my department in community development is not strengthened by the community health and community services. I mean, very, very similar names. And in fact, years ago, we're much, much more connected. But we've grown by leaps and bounds to become more connected, and we're really working hard to find where we have points of agreement and find where we have some overlap in our provision of services, and find how CDBG really acts in ways that you might not realize that we're funding a program that is very, very similar to something that they do, but how can we work together on these things? And so we've actually, now that we have our, a lot of our homeless programs that really have migrated down, I say down, it's one of the Texas Avenue when I call it down the way. We're actually finding more opportunities to kind of knit those two things together. And so I wanted this committee to know just more about some of the initiatives that we're doing. We are getting a University of New Hampshire that's going to be shared between the public health immunizations program, the public health, the health and community services part of public health, and then ourselves. And we're really looking at specifically older residents that are aging in place or living alone. We're looking at how to strengthen some of our housing intake processes. And we're also looking at how to explore other ways of collaborating with like our homeless services field work. So these are ways that we can continue to try to figure out how to stay connected, and that we know what type of work they're doing that's very, very similar to the work that we're doing. So it just sort of makes sense. So that's really just a little bit about everything, I guess.
Yeah. Thank you so much, Robin. We really, really appreciate, again, just all of the information that you shared and made available. Just while you were just talking about the collaboration with the Health and Community Services Division of Bangor Public Health. Obviously, we just heard from Jen and the needs that exist. Does the partnership look more like a partnership between your office and the office of Bangor Public Health, or is there a funding component for these?
There is a funding component. So when I first began here with the city, we were beginning our negotiations of a contract to start BCAT. And BCAT at the time was situated underneath the public health director. And we in community development were the funders. And this began the link, you know, to figure out, oh, we're doing similar things. So we were very close starting up with the BCAT team. And then we also added another companion program, which is called the Welcome Home program. And so it's a dedicated little pot of funding that our staff meaning public health staff, have used to address some of those funding challenges that really aren't addressed in other ways. So things like, I need to get a state ID. I need to, you know, pay a security deposit. I need to pay a utility deposit, things like that, for which there really isn't another dedicated source.
Okay.
So, yeah, and so again, and we're you know, trying to be open to other things, but that would only be accomplished if our communication is really tight.
Thank you. Thanks for that clarification. Are there any questions for Robin while we have her with us for this update? Yes, Councilor.
Well, I don't know if it's a question, just a comment. And it's this, the presentation you brought before the Business and Economic Development Committee was so good. And if you haven't seen it, you have to see it, because the amount of data that you dove into with housing, with wages, with you name it, it really, it was a lot of good information. I don't, again, not a question, but I think that everyone should see it.
Thank you for that recommendation, Councilor Beck. I definitely will be going back to watch that, because I can only imagine the amount of data that you actually have to share with these collections, and it would be, I mean, this, you know, 2-pager is so comprehensive. I definitely would love to learn more.
With the caveat that my presentation on that day was, it was a needs assessment and a market analysis. So it really is heavy on what are the problems. So I think it's important to mention that. And then we are going to come back after, you know, we mix up this soup and we, you know, put it together with a strategic plan, which will potentially be more positive. I mean, by design, it should be more positive, right? So.
Well, yeah. In a perfect world, the plan is actually helping to eradicate the problem. So yeah, absolutely. But I think that, you know, just given the number of individuals on this committee and their connections, just being able to say like, hey, I see that this data, you know, is really pointing to a need here. Let me connect to this person, or have this experience, or have you thought about this? So I think that'd be a great recommendation for us to check out.
Absolutely.
Yeah.
Where am I
Thank you.
Oh, cool. Thank you.
So you can see the presentation itself using, I guess it would be the agenda and minutes page, which should be sent out just.
No, it's youtube.com/City of Bangor. If you click the live tab and you scroll back to the latest Business and Economic Development Committee, do you remember the date?
It was a week ago Monday.
Okay. You can find that, but what I will do is I'll send the committee a link to the YouTube and to the packet that has the presentation that Robin did such a great job going through.
Yeah.
They come in all the time. We love it.
Yes. Yeah.
Awesome, I'm glad.
Yeah. Thank you so much. Anything else for Robin? Thank you. Well, thank you again so much for
coming in.
We really appreciate that.
Have a great.
Thank you. Thank you again. And we look forward to, again, just to reiterate, if you are interested in supporting that project, reach out to Courtney so that you can be a part of that process. All right. So that concludes our education piece of the agenda. Moving on to events. I quickly want to reiterate, you know, thank you to all of the committee members here that really stepped up to participate in our Pride booth. We had a really great day of meeting with different members of our community, answering questions, and really just making sure that we're, that they know that we're there, right? And that we're eager. I mean, you were all there. It was a really great showing from this group, and I'm very grateful to that. We were able to collect some information, not only, as Robin mentioned, on paper with individuals writing different updates, but also through a survey that people took while they were there. We had a QR code that they could take, or people, took the survey home and took it another day. So we've compiled that data and into a presentation that I think would be helpful just to look at really quickly, so then we can evaluate what are we going to do with this information. I think that, to me, is the biggest goal here, is not just in being present and telling people we're here and we want to learn from them, but also saying that we're going to do something with this information. So as we go through the materials, just keep that in mind of what really makes sense to go through.
I'm sorry, I just realized I didn't make it this hard for myself. I just thought I did.
What was that?
Yeah, this is what I want.
Okay, so this is our.
I'm gonna share this.
Thank you.
Sorry.
No, it's
Why are you doing that? No. There's always something in my way. I'm sorry.
No, it's fine. I want to be able to help you.
Why is
Do you have to open it in PowerPoint? Well,
No, I don't actually. Oh, I'm so sorry. Let me. Start. Here we go. Here we go. Katie, can you see that reasonably okay?
No, but
yeah.
I can see your screen. I also have a copy of it on my own computer, on my phone.
That's fair. I don't know why this. Oh, there we go. There we go.
Oh, there you go. We say
Apologies.
wonderful. All right.
Well, now I'm just looking at your email. It's okay.
Let me see. This is a good learning opportunity.
Safe space. Safe space. You are. I would be like, forget it.
Like we're done. There we go.
Yeah.
Better, Katie?
Yes.
Hey. All right. Wonderful.
And beautiful PowerPoint.
All right. So feedback from Pride. So as you know, we had about 8 questions. We also wanted to keep it very short so that we can make sure that we really got the best answers from folks. So Courtney, are you able to move through this? Okay. So the first question we asked is, do you feel like Bangor is an inclusive space? You will see that a lot of the feedback that we got from folks is pretty straight down the board of whether or not they feel included or excluded. Doesn't want to share. Doesn't want to share.
Can we just hold this up to the camera?
There we are.
I think I can use this instead. Won't be as in place, so I apologize, but there we go.
All right, thank you. And you can still see that, Katie? Yes, she can. Great. All right, so the first question we asked is, do you feel like Bangor is an inclusive place? So obviously you can see yes or sometimes. No was an option, and we did get 0 no responses.
Really?
So yes, that is positive. Next slide, please.
I got it out. Sorry.
All right. when you think about Bangor, what comes to mind? We really wanted to ask specifically about inclusivity and human rights. There was a lot of feedback about Pride. Obviously, people were there for Pride, but really I think that I would give all the accolades in the world to the volunteer group that put on Pride this year. There were events all June long. It was phenomenal. Libraries came up. When people, not all the things on here are positive. I thought that was an interesting take. Some people said when they think about inclusivity and human rights, they think about the economic disparities and not having housing. They want more groups to be able to reach out about equity and acceptance. There was positive responses on thinking about the queer visibility and representation and the welcoming embrace of Native communities, and that there are some opportunities to really expand the ways in which we are inclusive, that not every environment feels like an inclusive environment. There is some more information on that a little bit. And also, if you keep going, I will get to this. First, we'll look at the top reported barriers to inclusivity. Language out of the options that we gave them, language being having the least amount of people actually saying whether or not they responded that way because the survey was only available in English is something to keep in mind. That is something we hope to change for the future. But definitely lack of accessible transportation was the number one response as a barrier to inclusivity in this report. And again, not having buses, big event days like Pride or in the evenings, definitely we had a lot of conversations about that. And obviously, if any of you has specific things to add to this conversation based on the conversations that you had, you were all there. I welcome that. Financial costs, lack of awareness of events, physical accessibility, feeling unwelcome or unsafe. We did get a few responses of that, but that's a barrier to inclusivity. Lack of childcare across the board, and then again, language barriers were some of the issues that were reported by folks who participated in this specific Pride survey that we had.
When we look at the, lack of accessible transportation, financial cost, were those, I can't recall now, were those specifically related to this event or inclusivity in general?
In general. I'm gonna talk about that because the next question was, what should we prioritize to make it feel have more of a space of belonging? And as you can see on this, we had people rate it we gave them different options: housing, free space for communal gathering, representation of identity, background, and culture, and different events that we offer in Bangor, communication between city government and citizens, accessible spaces. If we go back to the second bar on this graph, the free space for communal gathering, that actually got the most responses. So when we look at that last report of the barrier being financial costs, what does that mean? It means, if I'm reading this graph correctly and people are, correlating their responses, I would take away from this that there aren't enough spaces for people to just gather in Bangor and not have to pay a cost. So if you want to get together, do you have to go into a coffee shop and buy coffee? Do you have to meet in a space that's costing money? We don't have a lot of open communal spaces, especially because 8 months of the year it's too cold to sit outside, besides the library, which did get mentioned on several occasions. So what can we do to offer those, third spaces that don't have that barrier and are welcoming in terms of a communal space? That is something that we should look at. In my very limited data analysis, that would be, I think, a trend that we're seeing here. But obviously, affordable housing is the number two, actually second to the free space for communal gathering in terms of how people ranked what they think is most important to make Bangor feel inclusive and to give a sense of belonging. Like I said, the other options were having more events. That the questions we asked were really long, so they're hard to fit on this graph, but rep of identity, background, and culture, the specific question was, do you feel like your identity, background, and culture are represented in community events? Like, is that important to you? there's a wider scope of feedback. Communication between city government and citizens. There wasn't a big response on that. And then accessible spaces was pretty, I would say even with the others in terms of the most importance. But I think we've got to look into that,
See, I don't know that I would come to the same conclusion you came. I would infer something completely different, and I would say this would be an interesting opportunity for the city of Bangor to start, or our organization to dig deeper, starting with these points. Financial cost could mean anything to whomever answered that question. It could be it's too expensive to even live in Bangor. It could be, lack of accessible transportation. Are we saying this lack of accessible transportation to these events is we brought this up in a meeting before, the fact that you have to specially call to get a van to get accessible transportation. I think these would be interesting opportunities to dig deeper, and I don't know that I necessarily would infer that financial cost equates to the next slide of accessible spaces. When I see accessible spaces, what I hear people saying is they don't feel like they can be themselves anymore. And that's why I'm saying I think there's an opportunity for interpretation, and we should not try to infer one question to another because of we don't have beginning data really to work on the individuals who are doing this, right? I know that there were lots of people who came from outside Bangor who came to it. They specifically live outside the city. I think I was speaking for in Newport who are coming in, they work here, they want to support the event. So I think it's interesting and this is a good place to start. I just think we should be very careful about connecting the dots on things just based on this. And I'm sorry, my scientific brain.
No, that's okay. I do think that bias is definitely playing a lot into this in terms of how we're individually reading this feedback. But I do think it gives us a good starting point and probably is an even better opportunity to connect with Robin in terms of the questions that they're asking the community so that we can say like, hey, we are seeing these trends. I do think that I understand what you mean in terms of financial costs. But there is something to be said that twice in a row, money is on here.
Right, but I guess that's what I'm saying is it's like you have to dig in deeper. Financial can mean multiple different things, to whomever you're talking to. And I think that would be this is the starting point of that deeper dive into
the absolutely. Absolutely. Yep, definitely. Okay, next slide. Okay, so these are things that Bangor could do better to make everyone feel more included and respected. Housing is on here several times. Listening sessions with the new city manager and other city leaders on a series of different topics was recommended. More safe places for trans people to go, to feel loved and supported. Actually painting the sidewalk next to Charlie Howard's memorial. The fact that the rainbow chalk was on it wasn't actually on the crosswalk this year, it was just painted next to it. Came up a few times, people thanking us, just to look around and see you make an impact, everything you do. Say there were so many positive folks there. And then obviously more autism friendly opportunities for shopping and experiences. Again, this is pretty equitable in terms of people feeling excluded and unwelcome and unsafe in the actual data. Some folks did write experiences. I personally wasn't comfortable putting that on a slide for all of us to share, but I will, I think we all have access to the responses. I'm not sure if those were printed into the packet.
Yeah, it was.
Okay. All right. So there are some responses in here, but there were specific, experiences that folks had in certain places that made them feel excluded and welcome and safe for the folks that answered yes. But again, that's a really split. It's almost the same as feeling included and feeling excluded. Obviously they're the same question in a different way, but it is interesting that we got 50% here and then 60 and we got no in terms of, the first question that we had. And then other helpful things. Folks, obviously, there's so much positivity and pride. A lot of people just, continuing to uplift the work that makes Bangor inclusive. And then, just a recommendation to the city councilors, making those meetings feel more welcoming. And I can't speak to what this person specifically was saying, but I did think this one was important to put on as advisors to the city council. If there are ways that we can just make sure all of those meetings feel like an inclusive and welcoming space, that is something that I think that we should look into. Yes, Counselor.
If I could, again, to speak for myself, I guess.
Yes.
I think maybe it starts as a conversation here about your own, what you see going on, and then make that recommendation, but here are the ways you can.
Oh, absolutely, yeah. Yeah, no, I think that all of this is going to need a great deal of digging into. I would love to, and I, volunteer myself to connect with Robin further on this, because some of these trends that we saw, I do have more questions about why they came up in the way that they did and what those specifics look like. And I think that if she is putting together these surveys for more folks to take and ask these questions, what questions are they asking about financial burdens? What questions are they asking about those third spaces that are important to the people of Bangor? And how do we make those accessible? And how are we defining accessible? Are we looking at strictly, can the tools that I use to move get me into this space? Or is it, can I be my authentic self? Or, is the language that I speak, available here? Am I going to feel marginalized in any way? And really a lot of the feedback in this was based on anecdotal feelings. And that's really hard to capture in a data structure. So what questions can we further ask, I think, to get that information?
And I think the great thing, the nice thing about it being at Pride is so many different populations are represented at Pride. That's, whether it be disabled community. I mean, it spans so many different groups. So it is a great starting point. And I think connecting with Robin would be an interesting opportunity, even if we can't connect specifically onto hers, maybe an opportunity to use, one of the students, maybe to use some of that to encourage a separate survey of some sort, or get some additional questions in there, because there are different interpretations of things based on the lived experience that everyone has. And if we really want to get to the heart of it, is it that there aren't enough, LGBTQ clubs, right? Or is it there's just not enough spaces for us to go to? Or is it that there isn't housing? There's just so many variables, so many layers that you can't get to and just check a box, but the check in the box starts the conversation.
Yeah.
So I think starting at Pride was a great opportunity to start that conversation.
Are there other recommendations that folks have besides, seeing where we can dig into some of these data points a little bit further? I'll stop there and open it up.
I agree that cross-referencing useful.
Yeah. I think too that we have specifically been talking multiple times about building a more robust communication platform on the website. And I think that would also be a great place to start. Like, hey, Bangor, we heard this, here to share more, something that we could continue to collect information. And that's something that I would love to, either put on the agenda for next time of like what we could actually do with that space so that we can move forward. I know that the webpage is on the agenda for tonight. But I do think that there's a lot more opportunity for us to build that out.
Oh, yes.
Yeah, but I think that, and my understanding that correctly, right, that we could actually garner feedback on the webpage.
That's actually why it's on the agenda.
Okay.
Yeah.
Wonderful.
Yeah.
All right. Any other questions or feedback on that?
Well, something we might want to consider for the next Pride event is after this information is pulled together and we are able to make some comments about it, that we might want to consider developing a very short survey, 5, 6, 7 questions, that at the Pride event, we can have people do them individually if enough of us could attend, we could sort of administer it to the people, and we might get more information that way.
Yeah, yep, yeah.
And
that's
it might be a kind of a more personal approach as well.
Yeah, that's a great suggestion. I think we have a lot of changes to make for next year's Pride, just given, you know, the language options. But I would also really ask this group, there's plenty of events in Bangor that we can have a presence at. So if you know of an event coming up or something has crossed your mind, I don't want to wait to just do this annually. I think there's a lot of opportunity for us to be present at different events where we can continue to ask these questions. All right. Next is the MLK breakfast planning. Shane, you are our liaison. Do you have an update?
Yes, so there was a meeting last night, which I unfortunately could not attend, but I read the notes, the meeting minutes, which was very helpful. And they are moving along full speed. The meeting last night focused more on fundraising efforts right now than like the actual event planning itself. But at the previous meeting, it had been discussed and decided that they were going to move ahead with booking the event at Jeff's Catering Brewer. So it will not be in Bangor this year. It is closer than Orono. I think it really came down to the funding piece, that it's just too expensive to host an event at the Cross Center. And they weren't confident that they were going to be able to get as much participation to cover that cost. So that is where we're at for now. They are working on a flat or tiered sponsorship kind of deal to help kind of pay for the event. My favorite thing from the notes is that they are working on menu adjustments right now to include some of Dr. King's favorite foods. And I love that. But yes, they're still full steam ahead, but the location has been set. They paid the deposit, so it will be in Brewer 2026.
Can you ask them, and you know, obviously they're working on the bigger pieces now, but I know that we had talked about providing additional support in terms of like education or different things that we can collaborate with them. So it can be, hey, here's the MLK breakfast, but if we can work with them on supporting transportation, if you come down to the Bangor Public Library, we'll have a series here or helping to set some of that stuff up. I think that has to be the way that we can show up, because I want to be able to support them beyond just, you know, darn, it's not in Bangor, we're out. You know, there's a lot of more opportunities. So I would love for us to continue to collaborate on that.
Absolutely. It looks like
Shane, I think I missed what you said. Where in Brewer is it going to be?
Oh, Jeff's Catering.
Oh, okay.
Yep. It also looks like they're starting to think about various breakout sessions. So maybe that's an opportunity for us to sneak in and maybe secure a session where we just talk about like, hey, here's what we do. Feedback you want to share?
Yeah, awesome. Thank you.
Yeah.
Thank you, Shane. Any other questions for Shane?
Not yet. I don't think they've gotten quite that far. They're still looking pretty big picture, but getting closer.
Because I was wondering if there was going to be like activities like if the younger population goes and focus on like educating them as well. It could be just like as simple as like just like reading a book to the kids or like a fun activity.
Yeah.
I like that. That's great. I mean, yeah, thanks for sharing that. Awesome. All right. I know that we are at our time, but I do think it's important this has falling to the bottom of our agenda. So if people are comfortable in talking about the 287G agreement, I think it's imperative that we move forward on it. As a reminder, we definitely heard from all of the individuals that shared with us earlier about the stance on 287G. As a reminder, it is the federal immigration, this section 287G of the Federal Immigration and Nationality Act empowers the Department of Homeland Security through ICE to deputize state and local law enforcement officers and enforce federal immigration laws and supervision. We have the opportunity as an advisory committee to recommend to City Council that they take a stance as to whether or not 287G, it has been very clear for the many months that we have talked about this, has always been on the table. The city of Bangor has never chosen to go into a formal act of partnership with 287G. This means that, you know, they've said, you know, we could deputize ICE, and we've said that's not needed, and we just left it at that. But seeing now that ICE is moving in ways that we have probably never anticipated, and also that LD 1971, as was shared with us, did pass both the chambers and the Maine legislature in mid-June. But after the passage, it was sent to Governor Mills, who could have signed it or vetoed it. She did neither. She's held the bill. So she has the opportunity within the first 3 days of the next legislative session to either sign it, not sign it, and it automatically becomes law, or veto it. What has been left to us to evaluate, and I think as a city, it's been like, well, we'll just wait and see what happens when the legislative process starts up again. And that maybe was fine 6 months ago. But as we're hearing from our, you know, individuals that live in Bangor, and we're hearing, I think, from conversations that we've had at past meetings, the wait and see approach is sort of losing its window of safety for so many members of our community. So here's what we have to decide tonight, what I would like for us to decide tonight, please and thank you. Should we make a recommendation to the city council to adopt a proactive resolve on not participating and saying we will not go into a 287G agreement with the, you know, Federal Immigration and Nationality Act? Or do we just say, we'll wait for what the governor says? Or do we say, hey, 287G's always been here and it's never been an issue before. Why should we get involved now? I know how I feel. And as such, I have included recommendations. In the packet, there are examples of different cities and how they have responded. Like I said, a lot of cities have done nothing. A lot of cities have just been like, you know, this has always been on the books, it's not a big deal. Some cities have made active resolutions to say, we publicly are announcing that we will not go into a 287G agreement. And I also added some stats here at the bottom about the actual outcomes of this policy and the outcomes of community policing when individual communities do go into an agreement with 287G, what the actual outcomes are. And I could just say that you know, the reduction in crime reporting. Studies show that when local police engage in ICE actions, immigrants are significantly less likely to report crimes, which actually weakens public safety. There are no public safety gains. The Cato Institute analysis found no crime reduction this is North Carolina counties and Maricopa counties in California that actually shifted resources away from emergency responses. Racial profiling has been documented. The DOJ found a pattern of racial profiling in, Maricopa, Arizona, and Almanchi County, North Carolina, which violated the constitutional protections. There are counties like Prince William County in Virginia that has spent tens of millions of dollars with no measurable safety improvements. And also Georgia Sheriff's, as an example, noted that removing 287G agreements improved relations and calls to police from immigrants rose and cooperation improved. So there is a lot of data, if that's where, and a lot of examples of how cities have operated. And in the essence of time, if we do make a recommendation to the city council of what this opposition to 287 agreement could look like, I also included a draft example that would have to obviously go to the city council to obviously be evaluated for any changes, whether or not they would accept it as a whole, make recommendations and send it back to us before it obviously went through legal and then 2 readings to actually go through the process. But I do think it has to start somewhere, and it hasn't started regardless of, in spite of all of the feedback from the community over and over again. So what is in our purview and what is in our best interest and what does this committee feel is most relevant to do, since we do have a quorum tonight and we can actually vote on what that decision might look like.
If I may, just real quick. So it would actually need to go to a council committee and then only one council committee, or council meeting, excuse me. And I was just asked to put out there, kind of similar to what Robin was talking about with the CDBG in terms of that word kind of being rejecting that plan. There is concern in some communities that have created strong stances on this, that their federal funding is being either withheld or threatened to be withheld, because what we're seeing is those agreements as they come through, the requirements that we have to abide by are being amended to include language like you must cooperate with federal agencies and things of that nature. So while I don't think we would sign a 287G agreement, I can't say as it would be recommended necessarily to move forward with something formal if it would put millions of dollars of federal funding on the line, because that has obviously a very direct impact on our taxpayers and our services. But again, that is something that I was asked to bring forward, and I don't have like the specifics per se on that.
I see Shane here, but I also see a question from our participants in the audience. But I'm gonna go with, I saw Shane's hands first, Katie, and then I welcome you to come up here and share with us, please.
It was just a thought that discussion should be had by council and not by us. Our role is to make a recommendation based on advocating for equity. I believe that submitting this to council for discussion is what we ought to do, and then let the councilors decide what's right for the city.
Thank you, Shane.
I respect that.
Thank you, Shane. Katie.
As a homeowner and a taxpayer, I'm more concerned about the safety of the people that live here with me, and my taxes are
Thank you. Thank you, Katie. Definitely something to keep in mind. Yes, absolutely.
I agree with Shane in this case, and I think that the very existence of our committee behooves us to make a recommendation to the council, and then the council can make the determination as to how to act on it. If you think about it, we exist. Our existence could be a thorn in the side of the administration, federal administration. And I think that we should be grateful that the city of Bangor sees fit to have a committee such as ours.
Absolutely. And I do feel like the number of voices that we've heard in the conversations that we've had, while I do know that city council works strictly in a, I recognize the great burden of, carrying the taxpayer argument, but what we have heard over and over and over again is that the people who live in Bangor is what make it the place that we want to live. I think that's the conversations that we had with folks when they said, what can we do better? What do you like about Bangor? It's the people, it's the pride that they have in each other. And I do feel that has to override what that cost potential might be, especially without any, it's not that I think I don't, not that I doubt you, Courtney, but without seeing that, I don't want to live in this world of making decisions on what ifs. We've done that for far too long, and I think it's gotten us really far down a rabbit hole that is a dangerous and unsafe and unwelcoming place to be. And I agree that giving options to the council to evaluate what they can do with this resolve and showing up in force with the folks that have showed up here tonight to reiterate that value is going to be important. This isn't like we made a decision in a vacuum and it's over. This is going to be an opportunity for us to meet with council individually, to go to those public meetings and to make this clear. What we have to decide now is there is a draft resolve that does say that, Bangor is committed to advancing racial equity, inclusion, and human rights, and strives to foster a community where all residents feel safe, respected, and valued. And whereas participation in federal 287G program would authorize local law enforcement to enforce federal immigration laws, a role that research and national law enforcement leaders have consistently found to undermine best practices in the community policing, erode public trust, and reduce cooperation between immigrant communities and law enforcement. I mean, there's several examples. I'm not going to read them all for the interest of time. They are in the packet, and I welcome you to look at them. Does this committee feel we should make a recommendation to council to review this resolve as a starting point, either accept as is and move forward, or make recommendations? Or do we just make a broad recommendation to them to please oppose 287G in a formal resolve without any guidance?
I do think for the sake of expediency, it would be way better if we just provide them with the draft and say, edit it. If we ask them to write it, no offense, city council is slow and they're divided right now.
Mhm.
They are not going to be able to get this done as quickly as if we just give them the draft and say, just fix what you don't like, instead of start from scratch.
I would strip our name from it.
Say it again, please.
I would strip our committee name from it.
So where it says, can you say more about that?
Well, this came up as a topic of conversation in January when we were first talking about making the welcoming statement. And I've always felt that if not sure who's viewing, watching city meetings, you know, all of that. Anytime you move a resolution, you know, you're not sure who's taking that and moving it forward. Is that putting more eyes on us, right? So we already know we have one group who said that their thing already got struck down because our committee name is in there. I think pushing this forward without our name attached to it takes out some of those keywords that people might have a Google search set for, you know, Bangor inclusion, what are they trying to do? That still puts it out there. Do we need to say that Bangor is committed to racial equity, et cetera? Do we have to say that, or can we just say Bangor, City of Bangor is committed to having a community where all residents feel safe, respected, and valued? I think we're still saying this, we're still saying the same, but we're taking a little bit of that target off. I don't know if the city has undertaken the stance of knowing exactly how many dollars we receive federally, but I bet someone knows that number to a penny somewhere, someone knows that. And I think it would be, as a committee who's committed to equity, we cannot talk about that right now. If we care about equity, we have to care about the funding our city receives. Okay, so you can't just disregard that in this. So if there's an opportunity for us to take something in here that we know is already a trigger point, and I know trigger is a very strong word for people, let's take that opportunity now. And then let's let the committee move forward. That's one less thing that they then have to decide upon. Because we know it is a bigger conversation they have to take on, that is their role. Let's give them something that does not cause a fight right from the get-go.
So it does say in this draft that the Bangor City Council, in alignment with recommendations of the Advisory Committee on Racial Equity, Inclusion, and Human Rights, formally states that the City of Bangor will not enter into a 287G agreement or any similar form of partnership that deputizes local law enforcement to enforce federal civil immigration law. And be it further resolved that this commitment stands regardless of the current or future status of the state or federal legislation concerning immigration enforcement partnerships, as a reflection of Bangor's value to commitment to equitable, community-centered public safety. I can understand the taking out that we don't need to put in the resolve that this is a recommendation of our advisory committee that stands as is. I also just want to make the point that if you have a Google search set to Bangor inclusion, you have a Google search set to 287G. Sure. So I don't want to, this feels, again, I think that we have to demonstrate that this is our commitment regardless.
But we're seeing the same, if you take out from the first one, the whereas, you know, if you we can say those, we're effectively saying the same thing by saying we are, but we aren't saying the same thing. I guess the question is, knowing that this is already going to be a discussion, I'm assuming not knowing what's actually coming to city council about this very topic, you know, how much ire there may or may not be, how much support there is. We know that we have support coming here. I'm not sure that we necessarily would hear all the negative thoughts and opinions here. I suspect they do come through, and certainly you could attest to it. I'm just thinking the opportunity, like, if we keep it in, that's, you know, that's fine, but is that another place where we're creating a fight and an argument? And you're right, that is ultimately the city council's making the decision.
You saw what happened when.
And that's what I'm
with
saying.
community development.
That's what I'm saying.
Yeah.
Maybe, I don't know, can we put up a couple of resolutions? I don't know, various language, does it have to be one or the other?
I don't think it has to be one or the other. I do think that it is in our best interest to give them a starting point. And honestly, you know, like when you're going to negotiate your pay, right? You go high and you know things are gonna get cut. My hope is that if you get caught up on the words like racial equity, inclusion, and human rights, letting the rest of this fall in, you know, of, you know, making an active stance against 287G, that feels like that space where, okay, fine, I will willingly give up the words racial equity, inclusion, and human rights. At the end of the day, what really matters is that Bangor is making a commitment to not engage in a 287G agreement, hard stop. I don't care what this looks like when it comes down to it. But like I said, it feels to me like a negotiation. Like, here are all the words, y'all can fight over the word inclusion. I just want to make sure at the end of the day that, you know, we're not participating in this.
I don't know if it's already been said, but I think in the last section, we should remove the word equitable. And just have it read commitment to community-centered public safety.
Yeah, I think that like that's what we're talking about now, is what this entire piece looks like. I do agree with you that does not need to say that that it's coming as a recommendation. Like, we don't need that in the resolve.
I think it would like what conversations or what's being heard from the community about this that we probably aren't hearing.
Well, I can't speak for the whole council,
right.
You know, but I mean, I can only tell you my own personal experience, and really the feedback I've gotten really was back in January when this was really a hot button issue, and it just has tapered off since then. So, you know, and that's just measuring through email. I hear from people time here and there, but not like we heard back in January.
Okay. We do have public comment, and we have the opportunity to open that up. We did hear Joshua already on this topic that said in the essence of inclusion. I ask you, Joshua, just for the essence of time, to please keep your comments to 1 minute. But I don't want to deny you the opportunity to share more on this.
Thanks, Katie. I'll try to be brief. I just wanted to say that, you know, as an economist and someone that's studied quite extensively, I think we have to be very careful in basing our decision making based on a potentiality of extortion from the federal government in the future. I think that becomes a measure of advanced compliance and capitulation, which it can be very dangerous for the purposes of municipal government. Beyond that, I would also ask the question as to, when we're talking about who we care about the situation, how we're making these decisions, and how we decide to make recommendations to the city council from any perspective, is who are we most focused on? Are we most focused on those individuals that are may or may not be predicating funding based on how we acquiesce to their demands, or are we prioritizing those individuals in our community that we want to protect and serve and support? And so that's my comment. I think we oftentimes get lost in the are we going to be getting money if we do this, and forgetting that the people that we're trying to protect, it doesn't really matter if we're getting the money if they're the ones being abducted off the street. So that's my comment.
Thank you very much, Joshua. I appreciate that. That said, and again, thank you very much, everyone, for the participation in this. And I think we've gotten a lot of good feedback. My first question is, before we take a vote as to whether or not to make this recommendation and to make it as is, how it stands now in the draft resolve. Courtney, if there are pieces of this that do need to be scratched or edits that people have, is that something that they have to say out loud now before we take a vote on it? Or can we take a vote to make this resolve and then? Do we make the, that would have been so embarrassing if that was me. I would have been, please get. Do we have to make the decisions on what this will look like before we vote on it, correct?
Well, I think it's likely to change to some degree as it goes through the council process.
Okay.
So I think what you can do is make the recommendation to pass a resolve that essentially prohibits the city of Bangor from entering a 287G agreement, and here's some recommended language. That would be my recommendation.
Thank you.
Sounds good.
Yeah. Okay. With that said, I would like to take a vote, again, roll, because we have Katie online. Thanks for being with us, Katie. Does the Advisory Committee for Racial Equity, Inclusion, and Human Rights make the formal recommendation to Bangor City Council to put in open opposition of 287G agreement in making that a formal resolution for the city? Mark?
Yes.
Katie?
Yes.
Shane?
Yes.
Ray?
Yes.
Anna? Yes. Katie? Yes. Okay, that passes 6-0. Thank you very much. Thank you so much for the citizens of Bangor that have supported this process, for everyone's patience and hard work on this. And we look forward to officially making this recommendation. I assume that the first recommendation will be is bringing this to
Committee. Council, yes.
Which
like the
committee is
government
that?
operations.
Okay.
Which the next meeting is next Wednesday. It's possible this may be able to be on that agenda, but if not, I'll reach out to you guys and let you know what those dates are. Okay.
Okay.
Yeah.
And then we would be there to make this formal presentation.
That would be ideal, yes.
You don't want to do it on your own?
This is a point of clarification, seeing if I put that report together. So can I, in my word, I say this can be expected to be seen on an upcoming GovOps agenda?
Yes, and that gives us just a little
Okay,
bit.
no date, just an upcoming,
Yeah.
okay.
At the next meeting, like.
All right. Thank you, everyone, for that. I do know that it's late, and I really appreciate everyone's participation. I do think that we have very much extended our time. We've had a really, really robust agenda, so I would like to recommend that these elements of like.
I'm happy to send an email about the Wednesday. It's published. You can go on there, take a look, let me know if you have feedback.
Wonderful, wonderful. Is there any other questions, feedback, comments? Wonderful. Thank you, everyone, so much for your time tonight. Can I have a motion to adjourn?
So moved.
Second. Can I get a second? Sorry, please.
Second.
Second. Okay, voting. Mark.
Yes.
Katie.
Yes.
Jane.
Yep.
Ray.
Yeah.
Anna. Yes. We are adjourned. Thank you, everyone.